Dr. Damodaran, what food habits are most important for heart health? What are some of those tics and techniques and those superfoods that you rely on yourself?
So, for a heart healthy diet, though, there are, certain diets like a Mediterranean diet, DASH diet, this diet, that diet, that may not be practical for our culture and tradition. On the other hand, what I am trying to say, overall, you should go for a more of a plant-based diet. After all, if you want to have something like a non-vegetarian, go for a fatty fish and egg whites. These are all okay. Otherwise, you should not go for a much consumption of meat, which has a lot of cholesterol. And also the plant-based means at least 3 servings of fruits per day. That is what recommended. And also rich of fiber. This is what basically in the Mediterranean diet. When coming to the oil consumption, obviously oil consumption and the dealing with oil is more of an oily issue. And you need to be very careful about the combination. What I generally practically advise to any family member who accompanies, especially ladies who accompanies the patient, I usually ask a number of people in the family, say, for example, go for half a liter of oil per month consumption. Say, for example, 4 people in a family, go for 2 liters. And the ratio should be like 3:1. One part will be of a monounsaturated fatty acid oils like gingerly oil or something like that. Whereas the other one, the 3 parts will be like kind of a rice bran oil and or sunflower oil. This is the reasonable this one. More than that, we should try to avoid the trans fatty acids. Trans fatty acids means they should not. We have the habit of always conserving things. When our mama prepare something in the morning, if there is a residual balance of oil, they will recook it with the same oil. That is more dangerous than obviously going for this. I think Dr. Vilas also could agree with me. So that is what the main issue, oil, because see, the oil is the main source of fat consumption, especially in our country, where a lot of masalas and kind of curries we used to have. So this is what so more of a plant-based food substance and less of low-calorie and high-fiber diet, fruits, and obviously nuts maybe in certain amounts will definitely make the so-called Indianized Mediterranean diet. That's what I can tell you. So this will definitely help you. Obviously, one should avoid preservatives, junk foods that everybody knows about that because they're all having some of the harmful ingredients. We all know that. Yeah.
Well, many thanks, Dr. Damodaran, for very eloquently putting it out. Our own structured, balanced, and Indian Mediterranean diet. Let's put it that way.
I just coined the word. I may be wrong, but just to add some flavor to that.
Yeah, because Indian palate, we need flavor. That there's always room for more flavor that can be added into our, on our plates. Younger generation somehow feels like the HIIT and this high intensity interval training is a cheat code to lose more fat and lose more weight in a lesser amount of time, which essentially is not the truth. It doesn't happen like that.
This is again obviously due to the busy schedule, so-called busy schedule of the younger generation or the current generation. So they don't find much time. So what they try to do, they want to do a high intensity workouts, maybe 2 or 3 days in a week, rather than going for a moderate intensity like walking or swimming or jogging, which is more recreational kind of exercise, which usually is advocated for a long time. But at the recent times, high intensity training without supervision. It is not that high intensity, all the high intensity training all bad, but without supervised program, if they do it, what happens, they will exceed or they will overexert. So what happens, some kind of plaque rupture or arrhythmias, which is the main reason for the sudden cardiac arrest. And you might have heard in news also, many youngsters, when they are working out in the gym, this is what happened. So when I put all this exercise for a healthy heart, for a heart healthy lifestyle practices, what I usually look at it, it should be more of a balanced kind of exercise. One should go for a aerobic exercise, kind of moderate exercise, like a walking for 30 minutes per day, at least 5 days in a week. Or one can combine that with resistance training, like kind of we have to have the muscle strengthening, other resistance, at least 2 to 3 sessions per week. So the combination, the combo obviously will help rather than going for a high intensity workout. So this is what I try to emphasize. People should have a balanced and way of looking at when they come to exercise. They should not try to achieve the heart health within a day or overnight. That is not possible.
If somebody, let's say, is wearing a smart watch, Dr. Dhamodaran, and on the smart watch you can clearly see what your heart rate at that moment is. So in an HIIT setup, if somebody is going in for a high intensity training, what is that barrier that one should keep a mental note of? Isse aage nahi jani chahiye heart rate, something like that.
Recently, people are more techno-friendly or techno-freak, I can say. Though they are, though we are not, in fact, wearing such smart watches, but when some of the patients, when they peep into my consultation chamber, they say, when I ask, are you going for a walk regular? They say, no, sir, I have completed 9,000 steps daily. You can see that. So obviously, that is another way of objectively, we cannot blame that, objectively telling that I'm doing this much of work. Scientifically, a recent study showed that anything more than 7,000 and less than 10,000 is acceptable. And if one is trying to push himself to do 15,000 or 20,000, may not be that much beneficial to the heart. And if they are healthy enough, if they don't have any other coexisting illnesses, or if they are younger, they can do it, but not for the heart healthy purpose, but for modifying the metabolic profile. Suppose if they are very obese, they can lose weight if they do more or prolonged hour. Because, I guess that you should have already discussed basically what is exercise. Basically, it's mnemonic, simple mnemonic, FIT, fit. That means frequency, time, and intensity. For a heart healthy exercise, you need to have a frequency of, say, as per the guidelines from Western countries, you need to do at least 5 days in a week of 30-minute session each day.